First of all, I do want to thank all the witnesses for coming today, sharing their thoughts with us. And in particular, I would like to thank Dr. Tam for all that she has done over the last several months. And really, it's been day in, day out. And I can't tell you how impressed I've been with your demeanor throughout this entire situation. So my first question is for you. Dr. Tam, you and I both know that contact tracing is an essential part of infection control, and this function is formed by local public health units across the country. It's very labor intensive, and it also requires quite a bit of skill in terms of investigative skills and diplomacy, because quite often people don't actually want to disclose where they might have been and who they've been with. And so it has been a real struggle here in York Region. I know our public health staff are working so hard. There's been a real effort to provide the search capacity given the number of positive cases here. So now we're hearing about contact tracing apps and potentially their use in a situation as we're facing at the moment. So could you give us some of your thoughts about whether contact tracing apps could provide some relief to what is currently being done through our public health units?
Yes, thank you for the question. Of course, there is many people are working really hard on this crisis, and I just happen to represent the tip of the iceberg of the public health system. And you're right in that the public contact tracing is a fundamental public health competency, if you like. And local public health has augmented the capacity, and what we've offered to provinces is that if you don't have enough people to do contact tracing, please let us know. We have developed a roster of people. I know that they've massively increased training, for example, for students or medical students or retired health professionals to supplement their contact tracing capabilities, but we're also here to help. Including federal public servants who may be able to assist. So there are different rosters being offered to provinces and territories. The application, I actually think that if you look at some of the other countries, what you have to do is have a population that is ready to use the contact tracing as well. You actually have some of the applications, Canadians have to sign up to them, and you need significant numbers of participation in order for that to work. So I do think that it is a concept that provinces and territories are interested in, and we've been facilitating some of the discussion on some of the options. And so definitely more to come on that. Some, for example, Alberta had started using an application. They are trying to get more people to sign up to it, but thus far, I think in the Canadian context, they are still trying to get more people to be recruited. It is something that Canadians need to be engaged in terms of this conversation, so that they understand what this means. Privacy, of course, is also something of paramount importance as these applications are being used.
Thank you. What sort of percentage of coverage would you need, do you think, to make it effective to use an app like that? How many people would have to sign up to use it?
Well, it may depend on the exact setup of the application or the technology, because I think there are different solutions. But I actually would have to, get someone who's an expert in this to let you know. But I do know that depending on the level of infection in the community, the number of contacts you have to trace in order to suppress the chains of transmission can vary. It can be between 50 to 60% of contacts have to trace in order for that transmission chain to be stopped. So you can imagine that it takes a significant number of people to have signed up to this for contacts to even be notified.
Thank you. Now, we all know that we make decisions on what we know when we make them. And based on that knowledge, we make our decisions, which leads us to data availability. And we've heard a number of witnesses who've come before the committee to suggest that even though you've talked about the great collaboration with provinces and territories, there is a real lack of consistency in public health data that is publicly available and in real time. There's been question about why wasn't the case definition the same for every province? Why wasn't every self-assessment tool the same? So in light of this and some of the comments you've heard this afternoon, would you say that there really is a need for the creation of a pan-Canadian public health surveillance system?
So first of all, the data gaps is challenging, I would say. And part of it is a capacity issue, potentially, at different levels of the public health system. We do have a pan-Canadian public health network that we actually have many national or federal, provincial, territorial surveillance systems as it is. But we do need to improve on the, we actually have national case definitions, but it's up to the provinces and territories to look at that, report to us according to the case definitions. But sometimes that does vary, and we do have certain data gaps that we must address. So this is a critical aspect going forwards, including, I think a lot of people have called for disaggregation of data, for example, according to race and Indigenous status, and that I know some jurisdictions are working on that, but that is still a gap for sure.
Thank you, Dr. Jaczek.